Not yet. Can anyone else see it?
How about now?
Wait. It's sharing. Here we are. It's
You
all
are?
yours.
You are able to see now?
Yes, it's a bit echoey though.
Okay.
Have you got another device that's on at the moment?
Okay, let me leave this device and just focus on one device. I'm now using my computer laptop.
Excellent. It's much better. The sound is much better. Thank you very much for doing that. And the stage is yours.
Are you able to hear me now?
Yep, I can hear you clearly and we can see the screen.
Hello, good afternoon, everyone. Good afternoon, Fadwa. Good afternoon, Car. How do you do?
Okay, can I start?
Yep.
Okay.
The stage is yours.
Okay. My study is related to patient safety concepts among medical and pharmacy students, and I apologize really for the inconvenience that was at the beginning of the presentation. So basically, our study has been conducted as a collaboration between two entities here in Saudi Arabia. The first entity is our hospital, which is King Faisal Specialist and Research Center Hospital, which is a tertiary specialized hospital, and the University of Alfaisal, which is basically an affiliated university that's joined in an agreement with our hospital to provide kind of training and also education for the students who are also considered really part of our customers in the hospital. So starting with the hospital, as what I mentioned, it is an academic medical center, and basically we do have other branches. It's not only located as a Riyadh center. We have a branch also in Jeddah and another branch in Al Medina city. The total number of beds for the three branches is around 2,000 beds, and also we are having a large community of employees, around 15,000 employees. The main services that's provided by the hospital, in fact, as what I mentioned, we do focus on tertiary specialized care for our patients, and we provide medical genetics, organ transplant, oncology, cardiovascular, and neurosciences. But also those are the areas of excellence of our hospital, but we do also provide other type of services that's needed for those patients, as also a help for them in order to be having more of comprehensive and more of holistic care in our organization. The university, as what I said, is affiliated with the hospital, and we do also care for the students at all levels, if they are undergraduate or postgraduate. So undergraduates, they do receive also educational and training in our organization, and at the same time, when they became residents or postgraduate, we do also support them by doing training. Now, the university is one of the best ranked in the region, and we have two colleges in this university, medicine and pharmacy. that we as a quality management department work closely with them in order to try to develop and help those students in order to be an excellent postgraduate residents or also workers in our organization. So our observation as a quality management department, we do receive many patient safety incidents, and we do have a system to capture those incidents from different departments in the hospital. And what we have noticed that there is a trend of certain incidences that comes basically from those postgraduate students, especially patient safety incidents, especially related to medication and providing care for the patients. And part of what we also observed that the way how to handle those incidences from the students was really not clear to those students. And we thought there is a need to tackle this area in one way or another in order to be able to really help our patients also who will be cared by those students and by those residents or postgraduate of course, students. So we had this agreement between the quality management and the university, and we started this research project. And basically, the focus of this project was mainly to assess the knowledge of those students in the university in relation to patient safety concepts. So this is basically the collaboration and the research principal investigators, which was myself as representing the quality management department, and also the university, which is again also the top level of the university was contributing to this study, which is the Dean of the College of Medicine. Also, we wanted to empower the students, so we selected also one of the students to be with us as investigator or principal investigator to help the students also in order to be able to collaborate with us answering the questionnaires or helping us with the study. Also, we are considering the research, the whole research, as a way to educate our students in order to be able to do researches individually later on. So basically, we went also with formulating a team for the research, and we tried to also include other members from quality management, mainly patient safety, and also we included other students who will be helping in capturing capturing the data from the university students. The background, as what I said, is really the incidences that we have found. But when we went to look into the literature, we found out that there isn't, in fact, any structured way of training patient safety in the universities, whether government or private. And this is not limited to Saudi Arabia, but also it is cross-border in other countries. Like China, we looked into China experiences, we looked into Australian experience, and basically all of these experiences were alluding to the same conclusion that there is variation, there isn't a structured way of teaching the safety concepts in the different countries, universities, whether they are private or government. So we thought so this is an opportunity to do the research, and we looked into what can be the aim for this research. So basically our focus is to assess the knowledge and attitude regarding patient safety concepts for undergraduate medical and pharmacy students. of Alfaisal University, and those are the concepts that we were focusing on: the types of human errors, reporting of errors, factors that contribute to human errors, how to speak up, and at the end, patient rights. So those were the main focus for our study. In relation to the population of the university, basically at that time, we did this study in 2019, and we had at that time 1,303 students in the medicine and 65 pharmacy students, with total of 1,368 students. So we looked into, we cannot, of course, cover all of those. So we tried to get a sample size from those students. And we thought we will try as much as possible to reach to 3 or 4 of those students completing our study to achieve 95% confidence level and 5 confidence interval. And we built and designed the survey to collect the feedback from the students. Our results, we were able, in fact, out of the distribution of a survey that sent to the students to calculate, to collect 3 or 4 survey that was completed by the students, and that made like 22% of the total population of the students in the university. Now, the questionnaires were 15 questions, and they are really quick to complete and easy to respond to. And basically, we wanted just to know if the students are familiar of the concepts that I mentioned before, and they are comfortable with applying them. The survey was conducted in the period of from March to September 2019 in the university with the help of the students who were part of the research. And we tried to make it as anonymous survey, so that will encourage the students, as sometimes they fear when they respond to such type of surveys. It might include, that they are not familiar about certain concepts. And we did analyze the survey results as a quality management in order to ensure the validity and the accuracy of the evaluation of the results. So the questionnaires in general, it's included in my presentation. So the first part of the questionnaire was mainly the demographics of each student, and was, as what I mentioned, we tried to eliminate the ID number, the university ID number from the questionnaires, and to encourage, more participation. And we tried as much as possible to get the important information that is needed for us to do better analysis. The second part of the questionnaire was mainly focusing on getting the feedback from the students in the availability of the patient safety course, and also the ability to see what their interest in the format and the type of that course that will be provided for them. Whether it will be in a presentations format, video, or hands-on, or so on. Yeah. Also, the fourth group of the questions focused on the assessment of the knowledge of the students, and we did give them different areas of patient safety to look into their ability and their knowledge of understanding this area, and if they are able to work with those errors in a proper way. We included also in this part the patient rights. The last part of our survey did focus on questions related to handling errors when it happens, and whether they are capable of handling those errors in the proper way. And we gave them different direct questions in order to monitor and see the way how they will deal with the errors and if they are comfortable in sharing those errors and handling them. The results from our study showed kind of interesting results. So basically, in relation to the knowledge and understanding of the errors in the, healthcare, we found out that almost 50%, like the results was 50-50. So 50% of the participants showed really good understanding of the different types of human errors and the contributing factors and others, but other 50% did not really give the same level of understanding of these areas, which provide us with a clue that we really need to do more and to work more on those areas. And basically, the students who are at the higher level of their study, at the postgraduate, or they are exposed already to the clinical areas, they have a better understanding of this area more than those who are just in their initial years of doing their enrollment to the university. The other part, and was interesting for us also, that we found out that in most of the areas, there was really good understanding. From the graph that you are seeing here, the green is basically the positive feedback, and the other colors are the negative feedback. And in most of the areas, really, there is a good understanding from the students about patient safety. However, we found out that they have a hesitance in sharing the errors with others, and they felt that they will mostly share those with only trusted colleagues. And this is one of the things that we also observed when we are really working within our hospital with the incidences that we are seeing. And all of you know that sometimes in our organizations, there is a hierarchy of the services and the authority. And normally those students will be reporting to their program directors and not to the units or the areas that they are working in. So where to report, where to share, and sometimes they are hesitant to share if something happened and it might impact their grades or scores in the university. So this area of speak up, we need to really focus too much on it in the hospital and try to promote more empowerment for those students when they come to our organization and start to practice and care for patients, because they will be considered accountable, similar to other staff within our organization. So in conclusion from our study, this is what we came up with. So basically, we have approximately half of the survey participants had an acceptable understanding of different types of human errors. However, they had little knowledge about the factors that lead to these errors and how to report them. So in the area of handling those errors, we found a big gap among those students, and also those students also will be later on postgraduate. So if they have this gap when they reach to the postgraduate and become residents, we will continue to have this gap. So we need to work this out. Most students understand the significance of patient safety education and showed eagerness to learn more. So they did really requested that to have a well-structured, patient safety course for them. Students recommended having an additional elective course on patient safety offered as part of the curriculum to achieve this goal. So they wanted something specific, and We found out from their response that most of what has been given to them is bits and pieces in different courses. It's not well structured, one course that will give them the whole concept or the whole story about patient safety. There was a strong recommendation also from the students to expose undergraduate medical and pharmacy students to real life patient safety situations. So yes, they are in the university, but they will come to the real world soon after finishing their studies, and that would have been an issue for them if they come back to the hospital without being exposed to what they will be faced with in the real life. So this exposure will enhance the students' ability to handle situations they may encounter after graduation. So this also mandates more collaboration between the quality management, who really know the real situation, with the university, trying to bring the clinical part to the academic part and make them mutually available for the students in their university. Alfaisal University will be considering the results of the study in building a patient safety course for the students enrolled in the College of Medicine and also the College of Pharmacy, and collaboration with the Quality Management Department of the hospital will be established to provide the students with more practical examples. What we wanted really to what was requested by the students is to have more hands-on, to see really real case studies of patient safety and how to handle them, and to present something from what we are capturing in our quality management department. With this, I will conclude my presentation. I hope you have enjoyed, what has been presented to you, and I'm happy to receive any questions related to it. Thank you.
Well, thank you very much for that good presentation, Ms. Fadwa. I thought it was really interesting. As a student myself, I definitely thought it was quite interesting how they check for patient safety, their knowledge and understanding of that. And then after that, they basically implemented that change to try and get that across to them before they actually went out without the safety of a mentor, or that's pretty good.
Yes, and to tell you the truth, we are looking into implementing the outcome of this study cross-board in other universities as well, and we are hoping after publishing our study, it will be published soon, inshallah, to have and to encourage other private and government universities to be considering this approach and working closely with the quality departments to help them.
That's brilliant. Really good. Has anyone got any questions for Ms. Fadwa? The chat box. There.